In 1978, Nigeria, along with the World Health Organization (WHO) and other member countries, adopted the Alma Ata Declaration instituting the primary health centers as the basic structural and functional unit of public health delivery system. Its aim is to provide accessible and affordable health for all, especially those at the grassroots. Amid the resurgence of coronavirus in parts of the world, Nigeria is currently battling a recurring number of diseases, some of which are diphtheria, Lassa fever, monkeypox, and cholera. There are concerns that Lassa fever cases and deaths in the country may soar as the weather gets hotter. The million-dollar question remains: how prepared are primary health facilities to take on any disease outbreak in the middle of a pandemic?
We assessed 15 states in Nigeria, cutting across all geopolitical zones. And at the end of this research, we discovered that 80% of primary healthcare centers fall below the standard stipulated by the National Primary Healthcare Development Agency, NPHCDA, right? And then we started driving advocacy for these standards to, meet up to global standards, right? And then in 2022, we went back to these 15 states to validate our findings, and we further scaled the project to the remaining 21 states, including the federal capital. And we found out that upon assessing all 36 states together, the results are not much different from what we discovered in 2021. All right, about 80% of PHCs still fall below the standard. Over 700 primary healthcare centers, specifically 784 primary healthcare centers across the country, and we discovered that the situation is actually quite bad. Now, some of the indices that we ran the entire project by were service delivery, personnel, infrastructure, ability to host, store, and administer COVID-19 vaccines, right? And we saw that cutting across all these various sections, Nigeria's health system is in need of help.
With an estimated population of 8 million, Edo State, southern Nigeria, prides itself as the heartbeat of the nation, bordering Kogi State to the northeast, Anambra State to the east, Delta State to the southeast and south-south, and Ondo State to the west. In January 2023, Edo recorded at least 81 cases of Lassa fever, with a case fatality rate of 10%, whilst still battling cases of coronavirus. With all this in mind, we embarked on the tedious and dangerous journey to Esako East local government area of Edo State. A journey we wouldn't want to dare again. This is the Benin-Auchi-Abuja road in a state of disrepair. The contract for the dualization of the road project was awarded in 2012 by the Goodluck Jonathan-led administration. Years after the contract was awarded, even though work is ongoing, the dualization work is moving at a slow pace. The deplorable state of the road makes it difficult for health workers to get supplies from the state capital, Benin. One part of the road is completely taken over by trucks. Other vehicles are in a hurry, hoping they won't get caught in traffic if a heavy-duty vehicle develops a mechanical fault on the road. Just at the northern flank of Esako East sits Okpela community, a community that yearns for development. This is Ohashie Primary Health Facility, opposite the palace of late Okwokpelagbe of Okpela. It is one of the facilities wasting away. At the time we visited, it was locked.
Out of the 4 PHCs that was covered, I found this one as the one that needs the government urgent intervention because first, they have no toilets, And when you see the other ones, you can tell that the appearance of this one is worse than all the remaining 3. And once you gain access into the PHC, you see that it's an open space. When they have patients, they attend to them there. There's no inward for patients. During vaccination or immunization, everything is done in there. I think they have a place for a small store for medicine and a labor room. But every other thing is done here. And then they have a matron. She's the one that attends to virtually everything that has to do with health. She's in charge of them, but she has few assistants.
After making several calls to the nurse, she appears on a motorcycle, ready to attend to us. From outside, we could see the efforts being made by the health workers to protect whatever equipment they have in the facility. The facility is in need of rehabilitation.
Look at the facility now. You see, all these louvers are not broken. No. It's thieves that removed them. Like last week, we have in this room. From that room, they removed the louvers and they entered. So,
Still what?
Eh?
What did they enter to do?
They will think they will have something to steal here. But when they entered, they will have nothing to steal. Initially, they were stealing some small things here from the facility. But now, once they entered, they have nothing to steal. And they will go again. So they remove all these louvers you can see, and this room, these ones. So the challenge is really much on us because the facility is not fenced, it's not protected. These louvers are not supposed to be here by now.
This facility is expected to serve about 12,000 persons, but there are only 2 nurses and 3 assistants who find it difficult to manage the facility.
If you open the door, you see the toilet. These are delivery.
Nurse Clara takes us to the delivery room.
This one's in enter.
From the ceilings, you see the residue and markings of rain. Here, the Basic Healthcare Provision Fund seems to have recorded little success, but the sustenance of the scheme remains shaky as shortage of staff, accommodation, and inadequate equipment, among other challenges, remain. This center lacks basic water, sanitation, and hygiene facilities, and the waiting room also serves as a ward for both male and female patients.
Fencing of the facility, the louvers should be changed to glasses, protectors put in there. This BHCPF money, we started using it to do protectors. Then we now fix protectors and we'll be waiting for them to give us money again while we start doing the glasses. Then the fencing of the facility. And that small building there is quite okay, but no staff there. No staff there because the place is not protected. No protectors in the windows too also. If not, we would have been staying here. We would have been staying here, but no protectors. I stay at Okugbe, the center of the town. That is where I stay. It's about 250, 300 from here. To the place. No, 250, 250. 500 a day. We are just 2 staffs, and the place is not well protected, so we don't run shift.
So what time do you close?
Well, we close around 4, 5, and we put our number. So when there's an emergency, they call us. We come to take emergency cases. This place will be renovated. If possible, another place should be built for us. We have a land in the back. We have lands everywhere. A new place will be built for us. Equipment brought for us. The place fenced and protected. We don't even have a security here. So that is why we don't run shifts nights here. You should just imagine how this place will be at nights if there are no securities here. So the place should be secured, the place built and fenced for us.
COVID-19, did you get supplies, say like PPEs? Did you get the vaccines on time?
Sometimes they'll tell us there are no vaccines for us to give, and we keep on waiting. Then the vaccines will come.
For how long do you have to wait?
Maybe 1 or 2 days. 1 or 2 days. They are not treating us well, and we are supposed to be accommodated here for the work to be going on fine. We are supposed to stay here, and no, we are not mobile, and just we are not being treated fine.
With thoughts of the recent abduction cases along this Benin-Lokoja road, we hurried to Ekpoma. This is a comprehensive health facility commissioned in 2009, the Hihumudumu PHC in Ishan West. The fading paint on the walls of the facility gives a hint of what you might find inside. According to locals, this is one of the well-equipped public health facilities you will find around here. Moses Ozegbe is here with his wife for antenatal care.
We have health equipment there, you understand? The etc. there, the environment is not conducive enough for a patient to go and receive treatment there, you understand? So I have to decide to come to this place to manage here, to manage this health center here. Actually, the first daughter I had, I do my this thing, 2 places, both private and public, you understand? So I don't do it in one hospital. So I said, let me try here. This is my first time I come here to register my wife antenatal here, you understand? What I'm seeing is more better than the one I'm seeing at Udumebu, you understand? So here now, it's supposed to, as the request for health material like this, the government is supposed to provide it for them so that they can be able to work well. Then, 2, we're supposed to give them enough staff. They are short of workers, like nurses, midwives, employed, then pay them their salary. Imagine that someone will be working for good 6, 7 months, you don't pay salaries related to the government, to pay them salary. When you pay worker salary, the worker will have the Z to do their job properly, you understand?
Inside the clinic, there is only one health assistant on duty. There is no water. Health workers use their money to fill these containers with water, buy drugs, and make few repairs in the facility. The matron's office is used as a store for lab equipment and a consultancy room for patients who need some privacy. Since the matron was unavailable, we tried persuading the health assistant to speak with us, but she refused. She is afraid the information given might put her in trouble. Just as we were about to leave the facility, we met 2 health educators, sensitizing residents on the dangers of coronavirus and Lassa fever. Since they are regular callers at this facility, they gave us all the information needed. Health workers are asking for better remuneration and implementable health plans for patients.
Our campaign, we have been moving everywhere. We have been moving from one place to the other, giving campaigning to people concerning COVID, concerning the outbreak of Lassa fever, and that was why we just branched. I joined my friend to come to this health center. I'm attached to Idumebo Health Center. So in this place, what I really saw here is I saw, looking at the building, starting from the entrance, patients that are coming, most of them, they are complaining concerning the building. And secondly, you see there were no amenities. The things they ought to be using in these facilities, they are not there. No drugs to treat patients, nothing to sterilize our injections. The injection they are supposed to be using, no sterilized machine. Some of them, the glucometer, like somebody just walking just now, the glucometer they are using is the nurse that just bought it recently. They don't have glucometer, they don't have apparatus for no scale, just migrated to agency. Most of us, we have not been paid our salaries, and which is not supposed to be so. The mass service here, that is, what do I call it? The workers here, there's not sufficient workers. The health workers here, they are not sufficient. The manpower is very low. They cannot take the workload of this place. And as you can see, this community is a very large community which comprises of different health facilities. There's a health facility that is attached to this place. Just as I've just said it, I'm attached to Idumebo. Like Idumebo Health Center, this one is far better. And we have another one at Ikideo. Ikideo is another facility under this facility. This one is very good. When you get there, it's a nice saw. So when you look at it, government should actually come to our aid. We need government to come and assist us, to come and help us. There are poor people in this very locality. They cannot afford drugs. Government should provide drugs, subsidize the price so that they can come for their health care. Many people are not coming because they don't have money. Poison in your environment, your dustbin, make sure your dustbin is far from the house. Your dustbin, buy a dustbin that is being covered. Dustbin, when you put your dirty, cover and well, not let rats scatter around. Not let rats scatter your dustbin. Persons are telling us no Lassa fever, even if we have Lassa rat is there, we don't have money to take care of ourselves. Yes, government should please come to our aid, should subsidize these drugs, help them so that as they come, they see free most of these drugs. If they are free, they will come. You see some of them, they are not patronizing this place because sometimes they will say the drug is at a very high price. Because the nurses, they bought the drugs and they come here to sell to the patient. Why will it not go in a very high rate?
"20 minutes from Benin City, the state capital, we visit Ikpabaoha local government of Edo State. This local government has about 17 towns and villages and is predominantly occupied by farmers. Access in these communities can be difficult, particularly during the rainy season. That's the case in Uhie, one of the ancestral homes of Benin people. The roads connecting Uhie to its neighbors are not motorable.
The problem of Uhie, we Uhie indeed have. We lack of bad road. That is, we have no good road. And health center. If you talk of population, we are up to 4,000 people. We all are farmers in these communities. Iya no more, and there are other Uhie, but Uhie is the center of Saple Road. There is one at Ogege, after bypass. The second health center is Uhie. From here to Iya no more is 250 for bike. Motor is 200 for along the road.
Another problem is a dilapidated health facility hidden behind overgrown weeds. The health center in Uhie, Ikpoba, Oha local government area of Edo State is inaccessible, saying that at this time, the facility is closed as early as 12 noon, which was the time we visited. We made a few attempts to open the door. A few calls to the matron, who here is in charge of the facility, but no response. We decided to ask around. Perhaps the matron could be close enough for us to speak with. Just outside the facility, Ruth Godwin sells a few things. A face lights up to greet us, but behind a smile and enthusiasm to attend to us lie a sad story, one which this health center has a part in.
We get share, but patients no dey come.
Why patients don't come to your center?
They go say people no dey come because still dey weak the matron and the nurses. If they want say make here dey boom now, make government bring workers join where they go dey stay here. Because the metro, he say you no see workers where they go dey stay, but maybe they see workers like people where they stay here now. The place where they go open at till night, the morning they break. They still meet say the door they open now. They still say people they stay. You go they free people to come say this healthcare they work, but now maybe as you come now where they lock am, no hope. They'll say people know they work for this healthcare. Sometimes they go the metro they go come, they go stay 2, 3, they go. They no see anybody.
Even when she needed health workers, they were not there to attend to her dying husband or take care of her when she was in labor at 4 a.m. 11 months ago.
The time when I take birth, they no dey around that time. Yes, I enter labor that time around 4. That is, I go one of my nurse for this area. I call carry me go to their healthcare. I know say maybe I know, but that time now.
Residents have to rely on herbs, patronize traditional medical practitioners, or travel for about 15 minutes to access the next health facility.
The health center was jointly built by the community, state government, local government, and federal government. The nurses are here now. They'll be in best position to explain. Although the local government tried, they brought in staff and some little materials. The government should be well equipped, caring for the general health for the masses. Nothing of such. Our people do go down to the city to get hair care before our service. Let's be frank, they don't. At times, if you go there now, you may not see anybody. To be there throughout the week. But as at now, today, they are not there. If our women should go there for treatment, they are not around. They have to move to the city.
How far is the nearest health center?
Okay, it's not far from here.
That's like how many minutes or how many
But if you are driving by your car, it's about up to 15 minutes.
The deplorable state of this primary healthcare facility shows that series of strategies to revitalize the sector are yet to achieve the desired purpose. With a plethora of diseases finding their way into communities, what interventions will be put in place to ensure universal health coverage?